Hello, my name is Kevin. I'm from Companion Therapy Laser, and we're here to congratulate you on your new investment on your Class 4 Companion Therapy Laser. Not only will this bring you to better results with your therapy part, we now can do surgery with this 980 nanometer diode laser. So this is what we're here today to talk to you and explain to you different techniques on how to use this laser for therapy. When you invest in this laser, we give you what we call a surgical kit. We also give you online courses by Dr. Jeffrey Moll that we highly recommend that you take. And this is basically going to give you the basic principles about using a laser. I'm here today to actually show you how to take care of the fiber, technique, and protocols. That's what I'm here today. We are not teaching you surgery. We're not here to teach you surgery. We're here to teach you the physics behind it, how to take care of the fiber, and how to take care of the laser itself. So that's what we're going to go through. The first step right now, you know that you have your handpiece on your therapy laser. What we're going to do, the first step we're going to do on this procedure is take this off the back. This is called an SMA 905 connector. It's going to be the same connector with our fiber. What we do is remove this carefully. Pull it out of the machine and put the caps on the end of your fiber. We do not want to touch the end of this fiber, and we'll explain that in a few more minutes, how to take care of that. Undo the finger switch that's in back of the laser. Undo the finger switch. At this point, what we're going to do is we're going to insert our diode laser 600 micron fiber. This kit includes two fibers, 600 micron fibers. It also includes a stripping tool, and we will demonstrate how to take care of the fiber and how to strip it. It's basically like a wire cutter. This is a quartz glass. This is the actual glass, and this is called a cladding. We teach you how to strip this off and cut it. This is a cleave tube. It's a glass cutter. We teach you, and I'll show you more in depth on how to do this in a few minutes, and how to take care of this fiber. On the back of the machine, you have your SMA 905 connector, which is right in the back here. You take your cap off your fiber. Again, try not to touch the fiber, and we do have cleaning strips that when you had your install on the therapy part, we showed you how to use the cleaning strips to clean the fiber if you need to do that. If you don't touch it, not even an issue. At this point, we insert the fiber into the laser. Hand tight, you don't need to be real tight, you just want it nice and snug. Now at this point, what's going to happen, and I'll show you a little bit another thing, you're still on protocols. What's going to happen when I put my foot switch in, because this is activated by a foot switch, kind of like a gas pedal, and we'll talk more about that in a minute. And to put the foot switch in, one way you can insert it into the machine, into the back, clip it in and turn it. So it goes in only one way, and you turn it to secure it. At this point, what happened, it jumps from protocols to surgery. So now we're in a surgery mode. But before we start this, there's some critical things we need to talk about. Number one, you need to understand all the basic safety information that we taught you when we taught you the therapy part of this laser. Number one, you do want a laser sign. You want a laser sign on the door, so when somebody walks in, they know a laser is in use. Very, very critical to do this. Same protocols for the doctors. You do need to wear the safety eyewear. We don't recommend your special sunglasses. They need to be this wavelength for this particular glass. On the animals, they're going to be under anesthesia, so we don't recommend the goggles, but we do want something dark over their eyes to protect their eyes. So it's very important to do that as you go forward with this diode laser. So, and I'll probably repeat that a couple of times. At this point, we're ready for surgery. Now, to take care of the fiber can be inserted a couple different ways. Very flexible, as you can see. I mean, you literally can wrap it in your hand. If you bend it too far, being a quartz glass, it could break. So I like to check this laser every time when I start it up for surgery. I want to make sure that I don't have a red light shooting out down here because maybe I stepped on it or broke it. If that happens, you need to cut it here. You still can use this part as long as you can get to your surgery table. But typically, you'll probably get 50 to 100 uses out of each fiber if you take care of them. And we're going to teach you how to do that in a second. Handpieces can be autoclave, gas, cold sterilization. The fiber can only be cold sterilized. You do not want to put this into an autoclave because it will ruin the SMA at the other end, and you maybe get 2 uses out of it instead of 50 to 100 uses out of it. So this has to be cold sterilization. The tip of this fiber is going to be so hot at the tip, that's going to be sterile anyway. Some people like to use ultrasound sleeves. They can put an ultrasound sleeve over it, and that's what they use for sterilization. They can use a vet wrap, again, to do that. that. Handpieces can go into the sterilization. So these are, and all you do is you loosen up the cannula. You take the fiber, you push it through the cannula. You want it to stick out about 1/4 of an inch. And all you do at this point is tighten it down. Now we're going to use this just like we do our scalpel. So this is a tactile laser. That means I can actually touch the tissue. Most times, most CO2 lasers, maybe some of you are familiar with the CO2, is strictly non-contact. This diode laser has some different characteristics. So I can actually touch the tissue and use it like my scalpel, or I can do non-contact and vaporize. So I have two different options. One of the big advantages of a diode laser, I can work in a very wet environment where most lasers have to be perfectly dry in order to get the response we need. I can cut and coagulate in a very wet environment, which is very nice. Let's say a declaw, for instance. There's no tourniquets, there's no bandages, not a drop of blood. These cats are usually in and out within a few hours. There is a learning curve. Everybody thinks lasers, you know, you dive in, you think Star Wars. It's not Star Wars. You need to understand the physics behind this and how it works. Now, typically, most people like to keep it on for 10, 20 seconds. We teach you in this video, we have an audio on here that beeps. So in between every beep, you release it. It's kind of like a gas, on and off, on and off. You need to do that. It's called tissue relaxation. It gives that tissue time to relax. So we don't want to keep it on for a long time. Another mistake people make with a diode laser, they'll start it here and go into the tissue. What's happening here is this energy has nowhere to go, so it's going to glow. So what's going to happen is it's going to be very hot tip when you go to hit the tissue. So you could get some tissue damage at that point. So again, we're very cautious on teaching you the correct way to do this as we're going forward. At this point, our fibers here, we're ready to do our surgery. If we're working anywhere up around the mouth, the neck area, and we have a trach tube, I'm a very cautious kind of guy. On a trach tube, what I would highly recommend is you line that trach tube with either wet gauze, tinfoil, or something that the laser can't penetrate through that beam through. You're going to get some scatter, so if you're working on a stainless steel table, I recommend putting a dark towel down, but very little scatter. It's going to be very, very minimal. It's what you're going to get. Now, this laser is going to do a lot of things for you. It's going to cut and coagulate. It's great for biopsies. It's good for incisions, small incisions. I don't recommend large incisions with any laser, only because it takes too long to make the incision. Again, it's not a Star Wars laser, so I like to use it after we make the incision with our scalpel. When I get into the sub-Q, that's where this laser, the diode laser, really performs. And this being a 980 nanometer laser on top of the therapy, it's highly absorbed in water, hemoglobin, oxyhemoglobin, and melanin. So we get very good coagulation, which that's the big key about using this particular laser here. Again, you need to take the time to understand how this works. If you don't, then you could get some tissue damage, some sloughing, etc. So you really understand how to use this technique. We can teach you technique, which we can do on I like to come in with a piece of chicken or have you get a piece of chicken. And that's a great, skin on chicken is a good place to learn. We're not going to hurt it. And we teach you a couple of different things, how to try to make a cut without actually touching the tissue, just touching it, or put a little tension or traction on it and then make you cuts like butter if you take that extra step to do that. Again, if you do that, you'll have some great results. But if you don't learn declaws, I don't recommend doing one right away. I say maybe get a cadaver. God forbid you get one, but if you do, I would recommend working on a cadaver. So we're going to teach you, P2, P3, and how to do this. And we have PDFs that we can send you by Dr. Moll to teach you step by step, and several other doctors. So if you need any literature you have access to that to help you get to that next learning curve. You have access to me or my company at any given time. We're there to help you understand, again, how to use this therapy laser as a surgical laser. But once you start, it's not only going to give you better results. Let's, again, back to declaws. Humane Society hates declaws. They are saying if you're going to have a declaw done, you have it done with a laser. Less painful. We got some companies saying pain-free, nonsense. And I always go up to them and I say, can I try it to you? It's pain-free. Let me see how it works. They will not let me do that because it's nonsense. It's just not true. But it is a lot less painful because we're sealing off lymphatic blood vessels, etc. So that's why it's a lot less. These cats are usually up and about within a few hours, especially on the declaws. But you will truly enjoy this laser if you learn how to do it correctly. Take the course that we offer to you, the online course, just so you understand a little bit more about the physics part of the behind the laser. And again, you have access to do us. Now, to start the laser up, There's a couple more steps that we need to do to get the laser running. Activated by the foot switch, open up your foot switch. Put it down on the ground. At this point, we need to what we call initialize our fiber. That means I need to put a char tip at the tip of this fiber. And by doing that, the reason I do that is because I need a char at the tip of it. But let's say we're just starting, we need to strip it first. So this is called my stripper, nothing more than a wire stripper. All we do is stick this in, pull it back. It exposes the glass. This is the cladding. At this point, what we would do is we would take our cleave tool, which is nothing more than a glass cutter, put it on a solid surface, make one little cut across, snap off the tip of the fiber. You always want to put this somewhere safe that it's not on your surgery site, etc. Now at this point, you would start the laser up, take it out of the standby mode. You're going to hear 3 beeps and you're going to hear the lasers ready to be active. First thing you're going to see is nothing more than an aiming beam. This is very important because it's going to show you exactly where you're working all the time. You can turn it off if you don't like it. If it's kind of interfering with your field, you certainly can take that aiming beam off. To me, I do like it on there. Plus, it's going to show me if I got a good cut on my fiber. Now, I need to initialize this fiber. By doing that, I first need to put on my glasses. Even though I'm just pointing it down, you still want to be politically correct. At this point, I like to take a tongue depressor, and all I do is I put several dots on it, little black or blue dots, etc. At this point, all I do is take the fiber, I put it on there, going to get a little char. I do that twice. Now my laser is initialized, it's got a char at the tip, I'm ready to do my surgery. That's the only maintenance you have to do that. This has to be repeated every surgery. You can't just do it once a week or once a month. You need, every surgery you need to do, you need to put a fresh tip on here. And you also need to make sure you need a nice round circle, because if you see like a starburst effect coming out of that tissue, this fiber, that means you cracked the glass. And we need a nice, perfectly round circle to get our optimal cutting view. A couple more things we need to talk about. Number one, this laser is going to create a plume. You probably have electric cautery element or something in your clinic now that you're using. You know how you get that smoke. We don't want to breathe that smoke. They do have laser masks you can buy, but you need some kind of evacuation system to get that smoke out of the room. Plus, you don't want it going out to your front end where everybody's going to see that. So that's pretty important to make sure you take care of that. One other thing I wanted to mention on the handpieces. These handpieces should never get warm. So if this starts getting warm, that means that this fiber is burning back into the cannula a little bit. So at this point, what we need to do is just loosen this up, feed our fiber through just a little bit more so we make sure it doesn't stick into the cannula. Because if it does, it's going to fuse itself in here. That means we got to get a paper clip or something. It's going to be hard to get it out. One other application that's huge with the diode laser is endoscopy. On any biopsy channel, on any scope on the market, we have a fiber that will go down that biopsy channel, and now you can do endoscopy. Again, it can work in a very wet environment, and to practice this, I recommend taking your endoscopy, get a green pepper, a red pepper, make a little incision in it, if you will, go down and actually vaporize some of the seeds that are in there. That'll give you a feel on how it's supposed to look like. When you put it down any kind of scope, no matter what scope it is, storts or whatever, make sure the fibers comes all the way out of the cannula here. And it's coming out, and there it is, and then you lock it in place. You do not want to have, you want to make sure this is out a good ½ inch, because if not, again, this could burn back into your endoscopy equipment, and this could ruin it. So you gotta be very, very careful. At this point, now I can do endoscopy. So that's just another application that we find that's great for our diode laser. So it'll bring you to some ear. It's good for ear polyps. You can do those little otoscopes. Great for ear polyps. So a lot of different things. But again, we're not teaching you surgery. We're just teaching you the physics and how to use it. But we will teach you surgery on our surgical class by Dr. Jeffrey Mull. So please take advantage of that. That's pretty much the basics on how to run it. We do have a breakdown. It's a 2-page breakdown, a step-by-step that we're going to offer to you also, and hopefully with the video that will bring you to that next level. But again, please call us for anything that we can help you with, because we're here for the long run on the therapy plus the surgical part.